Welcome students. Today we will be discussing the cellular adaptations to injury. But before that, let's have a look what we have studied so far. So we have studied the core concept of diseases, diagnostic techniques that are being used in pathology. All the causes of diseases includes environmental and genetic factors both. Course of a disease, that how disease progression takes place, outcomes and consequences, and clinical and biological death. So before moving on to our next lesson, let's discuss it briefly. So first of all, how we can define the death? If we rescue a person drowned in a swimming pool, can we say that the man is dead? No, we can't say. Its heartbeat stops. He is not able to breathe. But the process of resuscitation can lead to the recovery. So we can't say the man is dead. Actually, that will be termed as clinical death, because death refers to either the clinical death or the biological death. That person can be recovered from the process of resuscitation. That is known as the clinical death. Clinical death is the reversible transmission between life and biological death, in which the process of resuscitation can lead to recovery. So, clinical death is the death of organs. It is prior to the biological death. While biological death can be termed as the complete death. It is the reversible state of cellular destruction, cessation of all the functions of the entire brain, which means it's the death of brain, and it occurs after clinical death. So we can say that clinical death is the reversible injury and the biological death is the irreversible injury. So now let's move to our next topic, that is the cellular adaptations to injury.